Welcome back from that break. If you just joined us, this is Children's special edition of Good Morning Abuja. And now we have conversation concerning children's health, how to improve their health, especially tuberculosis. And I have amazing couple seated, to tell us what they have on their plate for children. And join me in welcoming to my immediate right Dr. Benjamin Odeka, who is the Chief Executive Officer of Lady Helen Child Health Foundation. He is also a consultant in pediatrics and gastroenterology. I hope I didn't murder it. Good morning to you, Doctor, and welcome.
Thank you.
Good to have you here. All right, next seated to him is Dr. Francisca Odeka, and of course is his spouse. She is the operational director with Lady Helen Child Health Foundation. Good to have you here again.
Thank you so much.
Yes, I remember I've featured you on this program.
Absolutely.
This is the second time or third, if I'm not mistaken. Good to have you here again.
Thank you very much.
And I have to commend the good works you are doing for our children, for the nation, and of course for the society. Thank you very much.
Thank you.
God bless you for that effort.
Thank
now, you have a program that started on 22nd, and it runs through 26th, and most especially for children, improving their health and lots more. And you tagged it improving the health of children, tuberculosis children testing week. Can you talk to us about this week that you have set aside for children for their testing, most especially the tuberculosis? Is it different from that of adults, the tuberculosis seen in adults?
Tuberculosis, as we know, is the scourge of the old society and also the modern society. It's not gone away. And for anything, it's actually worsening. We expect as the health improves, the scourge of tuberculosis should decrease, but that's not the case. And in our vulnerable society, where we have health-related issues, nutritional issues, poverty-related issues, it becomes the dragon head that continues to remain in force, tuberculosis especially. So that as a premise, the Ministry of Health is actually going ahead with this tuberculosis week, ensuring that children are tested in specific areas and also screened, and so that they can find out those who are actually hibernating or keeping silent tuberculosis without being diagnosed. Because tuberculosis as it is such a bad thing that you may not know you have it, but the symptoms, just cough, either losing weight, sweating and stuff like that. And you keep spreading it because it's so silent, you just keep spreading it. And children in institutions are actually much more vulnerable to spread it. So the premise for this testing is actually conceived in the context of making sure that those people with OVCs, that's the vulnerable children, in our context we deal with the orphanages and those other vulnerable, and that's where we actually have this link up with the Ministry of Health to help them spread the message to the people we deal with on the grassroots, that's the orphanages. So we go to the orphanages that are linked to us with the Ministry of Health testing officers so that they can spread the message on how to reduce the scourge of tuberculosis, test those children who are in those homes, pick out those silent cases that are not obvious so that they can be identified and treated and therefore stop the spread within that particular area. Now if I just go a little bit further, just to put it in context, say in Africa itself, in statistics, like they say in Nigeria, people brand statistics and statistics and statistics. Statistics don't tell the whole story. The story of human suffering is different from numbers. But just to make people understand, tuberculosis is a disease of population. That's the way I put it in context. Because when you look at the top 3 contenders for the title of the world leaders in tuberculosis, they are India, China, and my good country, Nigeria.
Okay.
Top three in the world.
Wow.
Then, of all the deaths you get in Nigeria, statistically, has been recorded, 10% of that is actually from tuberculosis.
Okay.
Is that high? Then when you talk about vulnerabilities, children less than 5 years of age are actually topmost. They have people with HIV, they have people with immunocompromised, they have malnutrition, so you can name it. So when you put those targets, you can see where the darts hit.
Yes.
And the vulnerable. So testing, we see it as part of our own mission, because our mission for Lady Helen is to improve the health, especially of children, but focusing on the vulnerable group.
Okay.
So when the Ministry of Health and Women Affairs noted that we do, and we have this link with this group of patients, people, that's why they tagged that we should work together to go into these areas and pick up those patients who might need support. So that's been, I think it's the 24th, 25th, 22nd it started, we linked up on the 24th, 25th and 26th.
Okay.
So that's where it's ongoing, and we'll cap the whole thing on the 26th with a meeting with further discussions.
Okay, very well spoken. Let me take you on the aspect of the foundation's finding, even though he has touched on that aspect, but I want you to reiterate on it. What actually was your discovery, your findings, doing this testing within this week, these few days?
Thank you very much. As Dr. Decker mentioned, our vision and mission is to support preventative health care, because you find out that it's actually cheaper to prevent the scourge like tuberculosis that spreads like wildfire than actually treating it. And so this is where we are very passionate about anything that is any disease that can be preventable, for us to focus on it. So remember that the test is still going on. So in terms of the finding, it will take a bit of time for us to have actually the concrete aspect of it, and the clinical aspect of it. But let's just talk about the simple finding, the soft ones. For example, one of the findings is that we found out that those who care for vulnerable children are very interested in being tested. Okay. So which means that knowledge is power. So immediately that information went to them for the children to be tested, they opened up and made themselves available for it. And so that is an important finding for us, that anytime agencies of government really want to work with OVC, that giving those who care, those who are responsible for it, actually you get the resources, you get the support that you need in order to be able to do that particular medical activity that is needed. So the other finding is that there are real fear amongst the OVC that tuberculosis might be around the corner. Okay. And so it is important that they make the children available for testing. Okay. So, but in terms of the clinical outcomes, that will take a bit of time to gather it together.
All right. I may have to pause you here. Let's take a break. We'll continue the conversation, of course. I've been speaking with Dr. Francisca Odeka and also Dr. Benjamin Odeka, and the discussion has been around tuberculosis in children. The conversation continues shortly. Stay with us.
Happy Children's Day, Happy Children's Day to children all around the world. Happy Children's Day, Happy Children's Day, let's celebrate all together. Unique and playful, we are children, we are young, we have fun, we're the hope of the future. Jolly and fearless, we are children, we are young, we have fun. Children are the biggest treasure. We're precious, we're special, we're full of potential.
You're born to be loved. Thanks for being born and for the joy you bring.
Dream big and fly high. The sky's the limit. You can do anything. We're precious, we're special. We're full of potential. We're lucky to be celebrated. Oh yes, we definitely have waited for this day. We're children, yay! Happy, happy Children's Day. Happy Children's Day. Happy Children's Day. Let's celebrate all together.
I think the context of the whole thing is with things like tuberculosis, you call it screening. When you screen, you pick out positive cases, then you identify what you call contacts because it spreads. So when you identify contacts, you have to test the contacts to see if they are manifesting the disease itself. Then those who are actually positive will now be offered treatment. But before you do that, you need to confirm if they've actually got active disease.
Okay.
So some of them might need x-rays, they might need some more tests to confirm that they actually have active disease. And if they do, then there will be a programmed treatment that will be meted out to them, which will be prescribed medications, which is the standard as per WHO in treating those cases.
So going by what you said, there are levels
Yes.
in tuberculosis.
Levels of detection.
Okay, detection.
You can have, for instance, some people might have the disease itself, and
Okay.
it's quiet.
Okay.
Then, for instance, if they have a situation where their immunity drops, it comes up. Take, for instance, people with HIV. HIV just takes their immunity completely out, and tuberculosis becomes wildfire. So that's just an example. So some people might just have it quiet. Then when they have immunity depressed, it becomes manifest. So when they do the screening, there are different levels of interpretation. Then those who have higher degree of positivity will now move to the next stage to find out that an x-ray or something to confirm if they have active disease. Then if they do, they have the contact traced, because whoever is in contact with those index cases, we call them index cases, will be vulnerable to having the disease if it's not treated or identified early. And unless you stop that spread, then you can have a cascading effect, if you know what I mean. So once you've identified them and they're positive, they need treatment, a treatment program will be meted out to them.
Okay. Okay, that's fine. Yeah, in the treatment program, let me take a cue from his last sentence. In treatment program, is your foundation responsible for that, since you're collaborating with the Ministry of Health?
I think if you remember, Lady Helen Childhood Foundation actually have a program called Patient Treatment Assistance Program.
All right.
Okay, and that patient treatment assistance program is actually a flagship program for indigents who go into hospitals and they don't have the money, they don't have the resources. So if it were, remember that we are actually doing this program in collaboration with the Federal Ministry of Health. So they are the first port of call. You know, so for us, that will be part of the advocacy. So if any of these OVCs have this, for example, there's a child in the orphanage that has tuberculosis, and there are no mechanisms or resources for the child to be treated. As part of our patient treatment assistance program, we will take that on board, and we will work in the first instance in collaboration with Federal Ministry of Health. And the testing and the screening and the outcome is actually being spearheaded by Federal Ministry of Health. So that would be a collaboration. But in terms of vulnerability and in terms of our own vision and mission and getting the right health outcomes, our patient treatment assistance program will kick in.
And some, because of stigmatization, they might not want to come out to subject themselves for tests.
Yes.
I don't know.
The good news is, school level, when you go to school, somebody might be picked up. When you go to secondary school, they might be picked up. When you go to university, I remember my days when I went to university, in my first year in medical school, we all got tested for TB. It's all part, it's a standard.
Okay.
Do all this screening and everything before you enter. So I'm certain that some of those things still occur at grassroots levels. But if they don't, things like the Ministry of Health is doing with us now, it's another way of mopping up and doing that.
Yeah.
Now, coming back to the questions you asked.
But maybe before I ask the question again, is there any sign, like for a layman to know that you are prone to TB? Is there any sign that parents should look out for in their children? Is it coughing, consistent, persistent, that kind of... So what should they look out for actually to know that their children, are vulnerable to TB?
I think you look at TB primarily as a respiratory disease. Let's look at it that way.
Okay.
But let's also know that TB can affect anyone.
Okay.
Okay. But primarily it's a respiratory disease. So being a respiratory disease, cough is one of the big things. Okay. Cough that never goes away because if you don't treat it, it just keeps getting bigger and bigger. Then the infection spreads in the lungs and start damaging the lungs. You become really breathless. So you're coughing, you're breathless. You can't, even if you eat, because you're working hard, coughing, and you're actually losing weight. So in a child, it's sometimes somewhat different from an adult. The child will cough as much as you want, cough, cough, cough. And obviously some of them cough, 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 can't eat as much. So, and they lose weight. And that's what you call night sweat. They sweat a lot at night.
Okay.
Drench and really sweat.
Okay.
So coughing, weight loss, sweating.
Okay.
Is one of the red flags that tells you there's something not right.
Okay.
And we check again.
All right.
And they're not, when you cough and you have an infection with a bacteria, you tend to have fever, you have all those things, and you're unwell for short periods. This one is for a long
period of time.
It's not going away. So cough for such a long time is something you need to suspect as a problem.
All right. So maybe I may have to take you on the aspect of the recommendation that what would you suggest to government to do as a matter of urgency to curb the further spread of this disease, TB?
I think just to reinforce the point that Dr. Odeka made, is about knowledge sharing. It's about sharing information about tuberculosis and also making screening accessible at all the levels. I was just reflecting on the point that Dr. Odeka made, that he was tested for tuberculosis when he was in university. I'm not sure if I was tested. It's cheaper to actually prevent than to treat, when the individual is already infected with tuberculosis.
Of course, prevention is
better than cure.
Yeah.
So for me, it's about accessibility of the screening and making it concrete at all community-based level, and also to, like you say, it's not about stigmatization, but it's about saying this thing exists in this country, so let's make it public on this particular week. Just as we keyed in as an NGO for every other health NGO to key in, and let's make it something that have an impact.
All right. Thank you very much. And really, you are making an impact. All right. Maybe I will just give you a few seconds to round up.
Just to reiterate that fact that the government is already aware of the need for screening and contact tracing.
Okay.
Because we're one of the 80% in the world that actually don't follow up on proper screening. So we already know that. The government knows that. So my own suggestion is, please, can they ramp that up? Make it a priority and not firefight.
Okay.
Go in when there's an issue, deal with it so that it doesn't escalate. Not coming in when it's escalated, because we are not doing well with screening. We are not at all as a country.
All right. So since it's still a week of screening, how can they access you?
I think what we've done now is that because we are a snapshot, we've picked up 6 orphanages.
Okay.
So that because some of them go to school get them, so we want to disrupt them. So we pick those 6.
There's a National Tuberculosis Center isn't it?
Oh, yeah.
That can be contacted.
Yes.
To do that.
Okay, and the testing is free.
Yes.
The screening is
Yes,
free.
yeah.
Okay, that's very important to note, and it's free because some people might not want to subject themselves to the test because of the financial involvement.
Free
It's
treatment, free,
free.
I think, because WHO is involved, the health is involved, and it's not because if you don't treat TB, the whole country will get it.
Sure.
So,
Thank you very much, Dr. Benjamin Odeka, for the noble cause you've engaged yourself in. Thank you. We appreciate you. Dr. Francisca Odeka, we appreciate you, and we say good luck. Do you have anything to tell Nigerians aside what you have said?
all we say is that get screened. It's not a taboo. If there's a problem, get treated. There's treatment for it. It's not a life sentence.
Yes, thank you once again for coming, for educating us on tuberculosis, and also for the charity work you are doing for humanity. We appreciate you so much.
Thank you very much.
Thank you. You've heard it all from them. Go to the TB screening center. It's free. Screen yourself and make sure that our society is free of tuberculosis. The program is Children's Edition of Good Morning Abuja. It continues shortly. Stay with us.